people take a lot of stuff for granted. Simple things such as walking, exercising, being able to stand for work, all that stuff seems like just a normal thing to be able to do until it becomes a problem. And so being able to help people navigate conditions that limit those activities has been beneficial, and it's been an enjoyable part of my professional life.
I love being an orthopedic surgeon. It's a fun job. It's very rewarding. We have a good group of guys that are working together towards a common goal. To work hard and figure patients' problems out and then watch them get better. They come in with a limp and they walk out without a limp. And we allow them to get back to their life with their spouse, with their kids, with their grandkids, and have a more quality, fulfilling life. That's the best we could ask for.
OrthoAlliance is basically several different practices that have come together really to join forces so that we can take the best care of patients possible. There's people in the group, whether it's hand, total joints, trauma, spine, you name it. If it's something that obviously I'm not going to treat as a foot and ankle specialist, then we can refer to one of the partners/experts to evaluate that and get it treated.
Joining OrthoAlliance has really expanded our footprint. Now we have multiple colleagues who have expertise in other areas that we don't, that are focused on that one specific element of care and treatment.
Maybe there are some specialists that really specialize in one area where a patient needs more help, and our group doesn't provide it, but we do have, in the great umbrella of OrthoAlliance, somebody that does take care of it. And I think that really makes it easier for patients to see the right specialist.
With Orthopedic Alliance, we get this whole host of partner practices that we can team up with. So if we don't have the right specialist for you, we're going to get you to one of our partner practices that has a fellowship-trained surgeon that specializes in what you do. We're going to communicate with them back and forth, and that allows for a more cohesive, more streamlined approach for the patient.
What that means for a patient is that they'll still get the individualized care that we've always offered for over 80 years. What our partnership with OrthoAlliance is, we've just now have a more robust program of physical therapists and specialists to rely on to get you to the correct doctor that you need for your specific ailment, whether it's any part of the body, foot and ankle, spine, shoulder, hip, or knee. We got you covered.
Well, I think from a patient standpoint, they should have the confidence that if they come here, we should be able to take care of the majority of everything that they potentially would need. But just in case they have something that's a little bit more complex, we've got someone within our organization that we can send them to make sure that they get the care that they need.
A lot of the colleagues that we rely on have actually become part of OrthoAlliance. So the patient knows that if we don't take care of it, I can get you in front of somebody that I completely trust to take care of the problem.
Coming through our orthopedic urgent care, there's several advantages. First off, patient access. You're immediately accessing a fellowship-trained orthopedic surgeon rather than seeing a general nurse practitioner or an ER physician. Here, as you come in, you're evaluated by an orthopedic surgeon, and the appropriate workup is initiated immediately.
Most folks do come to us after a period of time where they have had some treatment, meaning that they've taken anti-inflammatory, they've done some therapy, they've done maybe injections by their primary care doctor, and it's just not working anymore. But we're happy to see anyone. So if your knee's been bothering you 2 weeks or so, we'll get you in and maybe give you some reassurance if there's nothing too serious going on, but also can initiate that treatment program right away.
Emergency rooms are for just that, emergencies. And if it's not an emergency, if it's a trauma that's not an emergency, if it's an injury, and even if it's just an illness, sitting in an emergency room, you're last in line if it's not an emergency. We want you to be first in line, and we can provide that. We can have you be first in line in our practices here within OrthoAlliance and within Central Ohio.
When pain gets bad, it's hard to do nothing. This allows us to be able to reach out and get people in a timely manner so we can get these things addressed, find a problem, solve the problem, figure out the best treatment algorithm to get them to where they can get back to living their lives and be happy.
Almost any other urgent care you would go to, you wouldn't see an orthopedic surgeon, and then they're going to typically send you to us anyway. So you get to, skip that extra appointment, the extra charge that go along with an urgent care, and we got immediate availability so they can get right in.
You're looking at saving potentially thousands of dollars by coming here rather than going across the street to the emergency room. And the typical emergency room visit might be 3 to 5 hours for something as simple as an ankle sprain, and where you would end up with a large bill, and you still haven't even seen someone who specializes in orthopedics. So when you come here, you can literally be here, be diagnosed, be evaluated, and out the door, really at the same cost of that you would have if you went to an office visit.
I think that what it comes to is ultimately trying to see the experts first. Those that have been trained the most, those that have done research, those that teach fellows, teach residents, and those that have great experience.
So we do any comprehensive musculoskeletal care that someone may need. And that certainly goes from anything from very simple, workups and diagnosis to physical therapy services, advanced imaging services, injection therapies, and then certainly a full array of surgical services as well.
Many things we do don't need surgery and can be treated conservatively with therapy, sometimes bracing, occasional injections or medications, trying to get people back to work or back to sport or whatever it may be as quickly as possible.
Even a problem that's surgical doesn't necessarily need to be managed with surgery. There's a lot of non-operative treatments that could be utilized in order to make that patient feel better, and that's what it's all about. It's about quality of life, what's right for that particular individual, and getting them back to the life that they want to live. That doesn't always mean surgery.
Every decision we make, we should make on what's in the best interest of the patient. To me, that's patient-centered. Most of the problems we have, there's not just one treatment, right? There's several options. And you try and figure out what the best option is for that person and that problem. When I see them back in the office in a week or 2 weeks and they come in, I want people to do well. I want people to come in smiling and tell me how good they feel. There's nothing better than that.
The majority of orthopedic problems are non-surgical for quite a long time, and so that's why you want to have an experienced orthopedic doctor to diagnose the issue and figure out what's really causing the problem so that you can address it. But most issues can be treated initially with what we call conservative management. That would be non-surgical management.
That's a common misconception among patients is they think, oh my gosh, I'm seeing a surgeon, that means I need surgery. We use surgery as a tool, and it's typically the option that we offer after the conservative options have been exhausted. And so our goal is to get people better in the most efficient way that we can. Oftentimes that's with conservative things that don't involve surgery, but unfortunately sometimes that doesn't always work, and that's where we want to be able to provide surgical solutions to give a lasting result.
Most of our surgeries are outpatient, or at least what we like to consider as a same-day recovery process, right? It's still a process of recovery, it's still physical therapy participation after surgery, but really gone are the days of multiple days in the hospital, doing therapy in the hospital, to eventually a potential nursing home discharge before they eventually go home.
Back in 2011, 2012, we came up with the idea of developing an outpatient center specifically dedicated to outpatient joint replacement. What we found was that the patients were happier. They were more mobile, they were more independent, and they were reaching their therapy goals even faster. And they were becoming independent patients much, much sooner.
We can do full hip replacements, full knee replacements, partial knee replacements. All of that can be done in a surgery center. The satisfaction is 98% across the board for our outpatients. 90% of my patients are going home within 4 to 5 hours of surgery. And so we are doing your surgery, we're getting you up, we're getting you moving, getting back to life again.
OrthoAlliance is a very unique set of physicians. We have all specialties, and additionally, fellowship-trained physicians within those specialties as well.
There's specialties for hip and knee surgery, foot and ankle, hand and elbow, shoulder. And so when you look at most of the surgeons, even in OrthoNeuro, and then across the board with OrthoAlliance, you have a unique group of orthopedists that have really the next level of training that comes with the fellowship training.
When you're looking for an orthopedic doctor, it's helpful to look for somebody that's been specifically trained or had a fellowship training in the area of what you're seeking care for.
You want to learn everything there is to learn about joint replacements, about shoulder surgery, about hand surgery. you do a fellowship. Fellowship is a 1-year super intense training program where everything is focused not on the entire body, but just that one body part. So if you have a fellowship trained surgeon, you can be rest assured that that person specializes in all of the things that you need for that body part.
These are surgeries that are going to last you a lifetime. Joint replacements, you may be getting in your 40s, 50s, 60s, and you need them in the last 30, 40 years. You want someone that's doing 700, 800 to 1,000 a year, not someone that's doing 1 a month and just dabbling in a bunch of things.
Within OrthoAlliance and all of our partner practices within Central Ohio, Southern Ohio, Indiana, it's all patient-centered. Every decision we make, everything we do is about the patient. And we're able to do that because we are physician-led. We're a large organization, but we're a cohesive organization that's led by the physicians of each practice. And decisions are made at the local physician level. Decisions are made and implemented by the physician leadership. And so we're patient-centered, that's our focus, and we're led by physicians that have that same focus on the patient.
What I'm most proud of is patients referring their own family members to us. And that's because they trust us. They trust us with their own families, just as we would hope that we treat them like our family.
The most important person in that room is the patient. A patient is everything. A patient's care is everything. That's how deep and ingrained patient focus is at OrthoAlliance, is that without them, we don't exist. So they are the front and center of everything that we do, period.